Good afternoon, everyone, and welcome today to the Flint Community Webinar Coronavirus. We are so thankful that you have joined us today, and we certainly look forward to sharing with you all of the information that we've worked so hard for these last 115 weeks to share every week on this webinar. I'm your host and moderator today, Yvonne Lewis, the co-director of the Healthy Flint Research Coordinating Center. And it has been an amazing 115 weeks that we've had the opportunity to be with you. And so we're going to take a moment today as we appreciate the partners who have joined us every week, but we're going to take a moment today and just think about and acknowledge the things that have happened over these last few weeks. You know, I looked at a document on the CDC website at the number of mass shootings that have happened over these last few weeks, and of course the most recent. And it has been most devastating to all of our communities. And I did receive a note from one of our participants that have been on our webinar for a number of times and a part of the Hispanic community that is asking us if we would just take a moment for those of you, whatever faith tradition you have, to consider this tragedy that we have seen so many times, unfortunately, that affect not only our community. Last week, a couple of weeks ago, we were talking about one of our own, Omar Sims, who had a loss of a family member in the Buffalo shooting. And now here again, we have members of our community that are affected by the shooting that happened the other day in Texas. And so there's a request for continual prayer for our communities and an appreciation for all the partners who are reaching out to provide some comfort for them today. Before we get into our session today, I want to offer an opportunity for Katie Baxter, who is with our Genesee Health System, to offer some information and resources for our communities who have been impacted. And I know we may not have been in that situation ourselves, but we're all impacted by this. So Katie, would you share some information with us today?
Sure. Thank you so much, Yvonne, for bringing up this issue, because it is a very tragic and heartbreaking situation. And so many people have lots of different feelings during this time. And even we've heard from parents afraid to send their kids to school, and children are hearing different things. It's very difficult. People are talking on policy level, what should happen, what shouldn't happen. It's a very stressful time, and there's lots of agreements and disagreements on how to respond. So it's very important that we're aware of how much this does affect us, and that we're taking care of our children and ourselves. So we do have resources at Genesee Health System. I did send some things for Heather Lynn. She might be able to put those in the chat. We can also reach out, feel free to reach out, and we do have some resources about materials. How do you take care of yourself at this time? And what are some things you can say to children and allow them to process this without, intensifying fear or anxiety? So some kind of do's and don'ts kinds of things. So I would encourage you to utilize those resources, and also to reach out and to get help if you need it. Sometimes we are able to do that through our natural support systems, and that's wonderful. And I encourage you to do that through our faith communities, our friendships, neighbors, coworkers. But sometimes we need more help than that. So please know that Genesee Health System is always available, and we have more resources than we've ever had to have chat conversations that sometimes you just need somebody to, I need some help getting through the day, or just I don't know how to process this, and I need somebody to listen. So feel free to utilize those resources.
Thank you, Katie. And Heather and I'd like to go back to our first slide to just say that this webinar is brought to you today by the Flint Center for Health Equity Solutions, the Michigan Prevention Research Center, and the Healthy Flint Research Coordinating Center. If we can recall, now 115 weeks ago, the Healthy Flint Research Coordinating Center sponsored the first community webinar on coronavirus. 115 weeks later, we're still here talking about the coronavirus. We thought it'd be 2 weeks, and we're still here talking about this very, very important issue. And I was asked a question: why is this so important, and why are we talking about this issue? And so I want to just take a moment or two to spend with you and say, for me as an individual, we talk about transparency. For me as an individual working in this, it's multiple facets. A few years ago, I started the National Center for African American Health Consciousness because we're looking at the many, many issues of disparity around African American health. And how do we become more consciously aware of that? I also had the privilege of being the director of outreach for the Genesee Health Plan, because in our county, there should be no one without health coverage. But we want to make sure that we get that word out. And then the Healthy Flint Research Coordinating Center during the water crisis, again, looking at how we can bring community and academic partners together to address the issues of research that was coming in our community, and how do we get more community members involved? What way can we get this information out? And now with the Flint Center for Health Equity Solutions, we're really trying to pay attention to how to make things more equitable. But most important in all of this is the community voice. So I'd like to invite at this time our community partners who've come on. I see Dr. Gordon, Latricia Gordon, who is with Michigan United, who's going to share with us today. I also see Gwen Richardson, who is a member of the community health worker team at Genesee Health Systems. Katie is still here with us. And we also have Dr. Lawrence Reynolds. Dr. Lawrence Reynolds has been with us for most of these weeks from the very beginning, starting off with us as a chief public health advisor for the city of Flint. But he has been instrumental in helping us get this word out. And then I also want to invite to be a part of this conversation, because we talked about healthcare and the importance of that is to be a part of this, Jim Melanowski. So I'd like for our community health workers, and Dr. Gordon, you're actually seeing what's going on in community. I see you got your mask on even right now.
Yes, I'm actually at a vaccine clinic right now, just administering the vaccine. So we're out here in these streets working hard to help decrease this rate and bring out decrease vaccines hesitancy and vaccine literacy. So out here in these streets, we have our team. We're at the soup kitchen today. We've done probably about 4 vaccines within an hour. The biggest thing that we find out is that people are saying, like, we built upon the water. Let me take my mask off here. Right, let me go outside. We built upon the water crisis, when we had the water crisis, and how the task force sprung into action. So the biggest thing is about we have the health disparity still, high blood pressure, diabetes, CHF, obesity. So those things we're also incorporating when we're at our vaccine clinic, high blood pressure, stroke. We're incorporating those for health literacy, how that plays a role in COVID-19. Myself being a person I could testify, about 3 weeks ago, I had COVID-19 and I had my vaccines and I was boosted, and I believe wholeheartedly that for me, that having the vaccine helped my body do what it was supposed to do to combat COVID-19, where I was able to have it wasn't really mild, but it was pretty moderate reaction. And so right now, like I said, we're out here in the streets. We're always on the go. We're popping up. We're doing home visits anywhere we're needed, just to have the access, vaccine equity, as a Dr. Verholden would say. So the biggest thing out here is education. I have Nurse T. We're partnered together with Hurley and Nurse T at this vaccine clinic, and also have her to come on in. But basically what we're doing out here in the street is education, health literacy, support. People want to know, like, okay, like Nurse T said, they really didn't care about us during the time before COVID. So now why does everybody want to come rush to our aid? What's the big thing? What's so special about the vaccine? We just provide education about the vaccine. We don't pressure people to take the vaccine, but we want you to make the best informed decision about your health. We're going to give you the tools. If you need hand sanitizer, we got hand sanitizer. If you need masks, we have masks. If you need educational written materials, we'll sit down with you one-on-one. We're approachable. We provide education. We're like I said, we're from Flint. I grew up in Flint, and so our passion, Michigan United passion is just we are the community. We're part of the community. So we're just here to serve with our gifts and our talent. And, you know, I just want to, one thing, I lost a cousin last year, and I don't want anyone else to have to experience it. They didn't have the vaccine when he passed away. And actually today is his birthday. You know, so that's the mission behind it. Just making sure we can help anybody that we can. We'll sit down with you. If you have high blood pressure, we'll get you information on high blood pressure, obesity, diabetes, CHF, stroke. The biggest thing, you know, it's still stroke. Stroke is the biggest thing this month. Like be fast, balance, eyes, facial drooping,
facial, arm, speech, and time.
So time is the biggest thing. Time is brain. If you're having, and we're trying to, people don't want to go to the hospital. Even myself as a healthcare provider, when I had COVID, I thought to myself, like, I'm gonna do everything I can. I don't want to go in the hospital. And I said, well, why is that? It's because when you go into the hospital, you're relinquishing control. People think once you get in the hospital, I'm at their mercy. And so, but we want to educate people that if seek out medical attention early. Prevention is the key. But if you have any symptoms of stroke, if you're having shortness of breath, anything, you contact your healthcare provider. Anything like any type of symptoms of stroke, you definitely want to get in right away, because time is brain. The more time you waste, the more brain cells die. So that's what we're honing in on this month is stroke awareness, mental health awareness. As I'm a veteran of the U.S. Army, and as you know, as I talk about, you know, learning myself that I had post-traumatic syndrome and how to cope using coping mechanism, and my team, Nurse T and Tanya Battle, you know, helped me to get out here in the community. This is also therapy to me. By giving back to the community, it helps me heal myself. And so I'm going to turn it up to Nurse T. Do you have any more questions for us?
Just quickly, Nurse T, as you coming, and thank you, Latricia, because, or I should say, Dr. Gordon, because one of the things that we wanted to make clear today is that this is real.
Yes, it is real.
I know that it's not unpopular. You know, we're not seeing a lot of the news media like we once were seeing, but this is still very real. But we also need to deal with it every day, like before COVID, but it's exacerbated by COVID. So Nurse T, you were mentioned to us once before some of the things that you do in helping people work through this process as you're out in the community. What are you hearing from people?
As far as COVID, the vaccination, we're hearing that we already had the vaccination, that we don't need the vaccination, and we're a little bit nervous about taking the shot. We're just hearing a lot of conversations to where people don't really feel comfortable. And so what we've been really trying to do is create a safe space in there where they go every day. So like right now, we're at the Flint Soup Kitchen, you know, coming during the times to where they come and receive food. So we were able today to offer vaccinations, pass out health information on stroke, diabetes, CHF, you know, anything that could be pertinent in the community. Just making sure that we're connecting to them and being relatable so that they can ask those questions and feel comfortable and not taking them out of their space.
Thank you so much for that. So it's really important that we know that these activities are happening right where people are. So Gwen, we also call you Dolores, but Gwen, so you're in another aspect. Thank you, Dr. Gordon and Nurse T. I see you out there getting the work done. So you got to pull your mask back up. But if you can't hang with us a little bit.
Right, you don't want me to get in trouble.
Don't want you to get in trouble, right.
Okay, I'm going to have to go off.
Thank you so much. So Dolores, as a community health worker, and of course you're at GHS as well, how critical is this conversation right now, and what's been the value of your participation in this work?
You know, I love their slogan because that's our slogan as well. We out here in these streets. Although today is my office day, I have to work in the office on Fridays. But everything that they mentioned, I can say ditto to that. But in addition to that, the mental health aspect is so important because while our water department was created in a response to the Flint water crisis, and as you talk about the disparities and the systemized racism, we also have to navigate people through all these systems that we've been talking about for the past 115 weeks. So what happens is we can help a family, but sometimes before we can even provide that mental health, before we can provide those basic needs, housing, food, shelter, we have to provide a mental health solution for the parent first and the children. I work with lots of families with children on my caseload. So we have to provide that mental health tool for the parent first. You know, it's like putting the mask on them first so that they can provide the opportunities for their children to be assisted as well. So that's one of the most important aspects that stand out right now. Even beyond Mental Health Awareness Month, we at GHS, and especially in our water department, we're out here in these streets and providing those services through our navigators and mental health workers, through our outreach workers, through the mobile health unit. And I think if we could clone everybody, we could do more work. But that's why we work with community partners, like every single community partners that was listed in the flyer at the beginning. And so it's important, on top of housing, on top of lack of transportation, some of them opportunities, and just the oppression that plagues our community and communities like Flint. It's important that we provide those mental health solutions. And it could be just something as simple as speaking with someone, just to release the pressure, you know, just to get it out of their head and out into the atmosphere. Some of the solutions are simple, but some of them are more complicated. Some of them will need case management and therapy and a psychiatrist and a doctor. So we have to partner with all of the resources that are available in our community to make sure that the individuals in our community are able to live their best lives.
Thank you, Dolores. And I think as you've mentioned, we can't do this alone. We need all of us. And I thank Katie for coming on earlier, because all of us are affected by this, by the COVID, by the mass shootings and the water crisis. All of these things affect us, and none of us can singly as an organization do that. And that's a big part of why we're here today, because we want our community. One of the things we said is early on is this is a local context to a global pandemic. And I've learned something through the last few weeks, and that is many things that are happening to us, people don't connect it to COVID. But it is COVID related. And so all of us are affected by that mental health moment. We need some support. And so I'm gonna shift over here to Jim Melanowski at the health plan. Our community health, our bilingual community health navigator was scheduled to be on, Perlita. And so she is now working with some of the families who are affected by the mass shooting. And so she couldn't be here to talk about what she's saying. But Jim, we're in a critical state here in our community, because we're hearing some changes in what's going to happen with healthcare coverage. You just want to make sure people understand the value of what it's provided to at the health plan as a way to address some of the other issues that our communities are facing.
Well, absolutely. I want to just reinforce what's been said, and you talk about these crises and COVID and water, and what about just inflation and just the higher cost of living? You know, during the early parts of the pandemic, we couldn't find toilet paper, and the grocery stores shelves were empty, and now people are having a real tough time with their utilities, and with, you know, paying their utilities and their water, and just having enough money to go buy groceries, and so that's you know, those are the challenges. And we have a whole team of community health workers that you know, really help people with that. And I know the community has those folks like Gwendolyn and so forth. But also, healthcare is so important. You know, you hear Dr. Reynolds talk about the fact that we need our healthcare. You need to go to the doctor and have a trusted person to go to. And so in the fall, they're expecting the public health emergency probably to go away, the federal public health emergency. And what that created in our community was that an ability for more people to get signed up for Medicaid, and which is full health insurance, provides mental health coverage, and all those things that people need during this time. And when that public health emergency goes away, dollars from the federal government go away to the states, and so they are no longer able to have all these people on Medicaid. So it's going to impact our community, because people, if they no longer qualify, or if they don't respond in a timely manner, will lose their coverage. And so it's going to be so important for people in the community that, you know, have Medicaid or have some type of, you know, like a Molina or Meridian or, you know, those Blue Cross, HAP, all those types of plans, to make sure that people know where they're at, so that we have an address that's current for them. So when the state sends out notices and wants to get in contact with people, that they'll be able to be reached. That's probably the most important thing to do right now, until we have more information on the changes that might be taking place this fall.
Thank you, Jim. So we want our community health workers to know, and I was looking for my note because I did get a note from one of the MDHHS staff that said, please make sure that you get that information update. This is really critical. And now is the time to do it. There's going to be a couple months lag time. And Jim, you can help me if I don't get this right. There's going to be a couple months lag time between when that determination ends, when the emergency ends, and the redetermination process happens. That's when they're going to look and see if you're still eligible based upon your income level.
That is correct. And so people will have time, but you know, we are all bombarded with mails and calls and all that kind of stuff. And so sometimes we don't know, you know, what to believe or what to do. And so fortunately in our community, we have like Genesee Health Plan and Genesee Health Systems and the Greater Flint Health Coalition and Hamilton, and places that have trained enrollment staff that can help people. And so I would just encourage those staff to be aware, and then also start making folks know about this so that they will be better prepared for these changes in the fall.
Yeah. So let's encourage them. If they get that piece of mail from the Michigan Department of Health and Human Services,
throw it away.
Don't throw it away. You need to open it up and pay attention. And if you don't have support, then there are places you can call in the community and get the help that you need.
Yeah, because sometimes it's hard to understand. Sometimes the stuff that's sent to us, you know, healthcare is not easy. And sometimes the words and the phrases and what you need to do, go seek help from somebody. That's what our community does a great job of, having people in the community who can help. And so all these community health workers, all these folks that are out in community can help somebody. If they get a notice like that, what should I do next? And they can help them.
Thank you. And we'll be talking more about that in the weeks to come, because we've been encouraged to continue the webinar. And so for those of you that are listening to us, and if you have questions, please feel free to put them in the chat so our team can answer them for you. So Katie, I want to just give you one more opportunity, and we want to close this segment out with Dr. Reynolds giving us, thank you, Jim, giving us what only Dr. Reynolds can help us with. Katie.
I'm just going to put in a couple things in the chat about how to talk to kids about school shooting, and also some things about remember to take care of ourselves. Because somewhere we said that earlier, and you hear about that when you're in the airplane, you know, put on your own mask so then you can put on your mask for your child. You have to be able to take care of yourself and be in a good place so that you can help your children or your neighbor's children or whoever that is in the community, if you're a teacher or a caregiver.
Thank you, Katie. Dr. Reynolds.
Oh, yes. And my colleagues have said most of the things that I would say, and definitely Jim reinforced the message about healthcare insurance is hard to sort out, and you must ask for help. I'm learning about Medicaid, Medicare now.
Medicare.
Whenever I have a question, I have to ask somebody, or I have to go look it up. So don't be ashamed. Get your questions answered. What I would like to talk about is testing. Testing is still important. We get the home tests. The federal government is now shipping out another allotment of home tests if you request one using the website. And I encourage people to do so. When I was traveling in the past 2 weeks, I would test myself before I departed. I would keep my mask on as I flew, regardless of what people were doing. But when I came home, I would test myself again. And then I'd wait 48 hours and test myself to make sure that when I went to visit family members, I wasn't carrying anything to their house. And if you don't have confidence in your ability to test, we still have those 3 to 4 church sites where you can go get tested. And I found that they're looking for people. You can get the rapid test, you can get the quick test, and I'm sure Dr. Hackert will tell you about, or her associates will tell you about the places where you can get vaccinated. But this is an ongoing issue. And like everybody has alluded to, in vulnerable communities, especially communities of color or communities that don't have sufficient resources, we are living in a pandemic within an ongoing epidemic of chronic conditions. So we definitely have to be attentive. And then as a pediatrician, it comes out. I can never hide it. We're talking about the formula shortage. Please dilute your formula. The formula is based, they call it a formula because it's made on a balanced formula to ensure adequate nutrition, calories, minerals, iron and calcium for a growing baby. So please do not dilute your formula. I'm from way back. Do not try to make formula out of evaporated milk and adding sweeteners. If you must, you can use an approved formula for a brief period of time for the average child. But if your child was a preemie or has any special needs, you should really talk to your pediatrician before you make any changes. But it is, remember, sometimes you have to do something because it's better than nothing. But it must be an approved formula, and check with your pediatrician. So, and then if your child is over 6 months, milk for a short period of time, if that's all you can get to and you can't find any formula in the stores, that is appropriate for a short period of time. And I'll repeat myself, do not dilute your formula. So here we are having this discussion about shootings, formula shortages, and a pandemic. In the middle of a pandemic, you know, we say, what more do we need? And as the previous speakers have said, we as the adults have to protect ourselves first and be conscious of our discussions around our children. If they ask a direct question, you break it down as simple, the answer as simple as possible about the shootings. But you know what I've learned? Sometimes you just have to turn off the TV and the radio. Sometimes you should just turn on some music and chill. Sometimes you should say, let's go for a walk, because this is how we protect our mental health during times like these. So I think I've said enough.
Well, thank you, Dr. Reynolds. I just want you to emphasize, you said some critical things about the formula, and I know, you know, this is, again, as we think about it, it's another impact of the COVID virus. So much is going on. But you said do not dilute the formula?
Dilute your formula because you disrupt the nutritional balance and you risk other complications like diluting the infant's blood, because there are minerals, iron, calcium. Those are the things that come into through our digestive system, into our blood system, to our organ systems. That includes our brain, our heart, and our kidneys and various others. And we must protect the correct operation by taking in correct nutrients.
Thank you, Dr. Reynolds. And we know everybody is not on the webinar today, so we hope that those of you that are listening will please share that with our families, our moms. I know that there's a program that's going to really work hard to get some formula into our community. When that happens, we will be sure to let our listeners know. I see you, Dr. Hackert, and thank you for coming on today. I know you had a special event that you were at, but you made plans to be with us today. So
I was Katie. So that link that talked about the different community levels was actually coming from me. And we are at a moderate for the community levels right now. However, we can't kind of feel too much assurance of that because I checked like Oakland, and Oakland's so big. Many people commute back and forth between Oakland and Genesee. They are at high. Washtenaw is high. Livingston, I think, may still be moderate, but it's still moving up. If you look at the national map, we're about as far west as this significant increase goes, but almost the whole entire East Coast is now at moderate or high. So we do want to wear masks as much as possible. If you are in any kind of indoor setting where people are, even relatively close, like within 10 feet, and you're a healthy person, I would still put that mask on, and do not rely on the fact that we're moderate, which is where people who are anyone who wants to wear the mask should, but if you're immunocompromised, particularly important to put the mask on. But we're going to be probably moving up along with the rest of Michigan because they have already moved up. So we're doing pretty good right now, but do put your masks on when you're inside.
So while we're right there, we have the slide that shows where you can get those tests. I think they're still being offered. Can you show that for us, Heatherland? If you are wanting to get free at-home tests, because it is encouraged that you test on regular, just as Dr. Reynolds said. So here's the phone number for those of you that are listening and cannot see the slide. It's 1-800-232-0233, the COVID test. And we're saying, and while you're here, Dr. Hacker, if you test positive, please call and contact the health department.
We do have a link on our website. So just go on to gchd.us, and right at the front, it'll have a little banner, and then it says, click here to report an at-home positive test. So if you can put that in there, it makes it much easier. If you don't have access to the internet, or you prefer to call, you can, but it's much easier just to put it in through there.
Thank you, because this is how we're going to learn where we are actually. And if we don't get that number, we'll know if it goes up. There may be even more people who did not report that are testing positive.
Oh, so absolutely, there are.
Yeah, so let's do that. Thank you, Dr. Hackard, and thank you to our team who came on to share in this roundtable today. We just want our community to know that folks are working hard. And I think all of you that are here are an example of the real important effort that we're making as a collective partnership to make a difference in our community. So thank you so much. We have a quick poll for you today that we're going to ask you to take right quick. Really quick poll about your, because vaccinations matter, but your voice counts. Excuse me, your voice matters, your voice counts. So if you could take this poll for us right quick, how concerned are you about getting COVID? There are some of us who've not gotten it yet, and we don't want to get it. So how concerned are you about getting COVID? How concerned are you about the long haul, COVID long haul? We're going to talk about that in the weeks to come. And how comfortable are you talking about your COVID experience? We're asking you to just respond to those questions. And I think there's one more question. How comfortable are you talking about your COVID experience? If you could respond to those questions quickly for us, we would appreciate it. And then we're going to hear from Dr. Susan Wolford. She's going to bring us an important medical moment.
Thank you so much, Yvonne, for this opportunity to share our medical moment for today. I think that over the past few days, really, we've had an awful lot of bad news. And so I would like to focus on a little bit of good news in our medical moment for this morning or this afternoon. And so let's see, we're going to focus on 3 different aspects of the news. We're going to look at news about the vaccine. We're going to look at news about the variants and some reasons to avoid COVID, which I think gets to one of those questions that you just asked, like why would people, or how much people would like to avoid COVID? Hopefully a lot. So let's start off with looking at the good news about the vaccine. There are so many things that we find it hard to protect the children in our community from. But now we can do better at protecting them from COVID, because on May 17th, the FDA authorized the COVID booster shot for 5 to 11-year-olds. And the CDC gave us more information, as they always do, and recommends that they get it 5 months after their initial series. So when they had the second dose of the initial series, then 5 months after that, they should get their COVID booster. So we know that the numbers of children who are actually getting even the initial doses is really quite small. But I just wanted to point out that we can protect them more by giving them the vaccine, and now we have information about the booster for them. Hopefully, within the next few months, I keep saying it's going to be next month and then it keeps moving out, but hopefully within the next few months, we'll have news about the vaccine for those under 5. We know that this week we were told that Pfizer's studies were very, very promising. And so hopefully the FDA and the CDC will take this up in June and we'll be able to come back with an update on that. Okay, so now let's think about the variants. So one of the studies that came out, we're learning about recently, is about how these new variants of Omicron actually have some similarities to Delta. So this is important because if you remember, Delta was more likely to cause severe disease than was Omicron, but Omicron spread even faster than Delta. But now the new variants of Omicron, which can still spread amazingly quickly, have some of the features of Delta. So there's a possibility that we'll have some more severe symptoms with the newer variants of Omicron. But more than that, it's possible that immunity from a previous infection won't really help us. So like if you got Omicron over Christmas holidays or the winter holidays, you may be not as well protected from having it again. So people are getting repeated episodes and previous infection may not be protecting as well. That just gets to the point that Dr. Reynolds mentioned, which is we need to do a lot of testing, right? You need to test if you have symptoms. You can't say, oh, I had COVID already, so it's not COVID again. You need to actually test as much as you've ever tested before. And of course, get your vaccine so that you can protect yourself against it. And then a final bit of news for today that I would like to focus on is reasons to avoid COVID. So one of the poll questions you asked was like how much people really are concerned about getting COVID. And by now, people are getting a bit tired and weary of doing all of the mitigation things. We're sort of like, oh my goodness, that is so 2020, and we want to do something different now. Unfortunately, there are lots of reasons to avoid getting COVID because new studies are showing the widespread effect of long COVID and how it is affecting so many organs in our body. And I just want to show this slide here, this picture that shows that COVID, as you know, gets into our body and into our cells and organs by using those ACE receptors. And we have those receptors on all of these organs here. And so all of them are at risk for having long COVID symptoms if we end up getting infected. And remember, it doesn't matter whether you had even if you had a mild case of COVID or an asymptomatic case of COVID, one can still end up with long COVID. And one of the studies that came out this week particularly focused on the fact that there are significant numbers of people who are having heart problems as a result of long COVID. And so I just want to tell us, we want to protect ourselves, protect our heart. letting COVID get into your body and into your heart here's my little corn prongs. It's like allowing it to poke holes in our hearts, getting in there and causing damage. So if you've been getting a little bit thinking, I don't mind if I get COVID, think maybe I don't want to let COVID poke holes and damage my heart or any of my other organs. And so with that, I think we are back to wearing our masks, getting our vaccines, staying socially distanced, even now in the middle of summer 2022 or the beginning of summer 2022.
So Dr. Reynolds, Dr. Wolford, thank you so much. You said Dr. Reynolds, and that was sticking in my head because he gives us that rundown. But as you're saying, Dr. Wolford, as we talk about the summer, when we talk about distancing, we're talking about just being physically distant. Dr. Heckert mentioned about 10 feet away. We still want people to have some socialization, but we don't want them to be so close.
We absolutely want emotional connection. This is not the time to be distant from people who are our support systems. How do we deal with the anniversary of George Floyd's death? How do we deal with mass shootings and babies being killed? It's just unfathomable. We need the support of those around us. But we have to do that in a way that doesn't allow more tragedy on top of already disastrous episodes. So we don't want to make anybody around us sick. So we do need to stay that distance away, wear your mask. Yesterday, I was at a graduation outside wearing my mask because there were a lot of people around, and I could imagine that respiratory droplets could get to me. So I had my N95 on while in the graduation. Took it off for a picture and put it right back on. Yeah. You have to keep yourself and those around you safe.
Thank you so much, Dr. Wolford. And it is a challenge for us that we have to keep all this information present for us. So it's really important that your voice counts. I think we have a quick summary of the poll. You may have seen it. Thank you for that inspirational medical moment. See if we can get the poll up so we can see what those responses are. Okay. There are people who are, I have to move my thing here. Okay, we are some we're in various places with our poll. Heatherlyn, can you summarize this real quickly?
Boy, talk about turnaround, folks. So you can see that, we're kind of spread out for this first question of how concerned are you about getting COVID? We've got a couple folks who aren't concerned at all, but for the most part, there is some at least moderate to extreme concern about getting COVID. We also wanted to know, how concerned are you about long COVID, right? Lots of people, this is on their minds, they're worried about it, and we're seeing those results here. Of the folks who responded, 48%, so about 50% of folks are saying that they're extremely concerned. And you, Yvonne, the two of us have been talking about this along with Dr. Wolford and others, that this is something that we want to cover in upcoming webinars too. Our last two questions here. How comfortable are you talking about your COVID experience? And you can see well over 50%, 56% of folks are extremely comfortable about talking about their experience. And then, are you currently or have you ever experienced symptoms of long COVID? And we're seeing 92%. So the majority of folks have not experienced any symptoms of long COVID.
Okay, and so it speaks to Dr. Wolford's, you don't want to experience them. And so let's do what we can to keep ourselves safe. And that's why the data is so important. So thank you, Heather. We have opportunity now to hear from Dr. Rick Sadler, who's going to give us an update on the data. Dr. Sadler.
Yeah, thank you. So we saw just slight decrease in the county and a very slight increase at the city level this week. And so again, when you look week to week, it's important not to read too much into an individual week pattern, but look at the broader pattern. So Flint has continued to increase for at least the 5th straight week. It might actually be the 6th now. I need to take a look farther back. But we have our rates, Genesee County and Flint are sitting at about the same rates. There's not a big disparity there. But rates of new cases remain the highest among African Americans who live outside the city of Flint. And so that's 268 cases per 100,000 as compared to about 180 overall for the county. So it's quite a bit higher among that subpopulation, and we continue to keep an eye on that. This week, the rate of new cases among that subgroup was lower than it had been last week. So it's not getting appreciably worse, but it's still disproportionately affecting that group. And then our testing positivity rate is about the same as last week, 22%.
All right. Thank you, Dr. Sadler. I appreciate that information. So we need to keep an eye on these, as you said, to see where this trend goes. And so we'll have our health department come now and give us an update on what's happening with the health department, what's available, what kind of programs and activities are happening in this next week. So Ashley's here with us today.
Hello. So
there you are.
Hi. Yeah. As Dr. Sadler said, we are, where we are with case data. We are right now reporting 105,492 total cases. We are seeing a decline in cases, referred cases, both confirmed and confirmed probable. We are keeping an eye on that. At this time, hospital inpatient numbers are also increasing gradually. As we would have expected, we are still falling within that 15 to 17 day timeline. So if we see a shift in increase in cases in the county, 15 to 17 days later, we can expect to see some movement in inpatient COVID admissions. As of right now, COVID cases take up a very small proportion of ICU beds. We do have minimal ICU beds available, but a low number of those are actual COVID patients. We have no pediatric inpatients at this time. The hospitals are all reporting that they're doing well. And the same for vaccination. We are moving forward with monitoring vaccination clinics and everything in between. We are on day 499 of COVID vaccination clinics since our first day of clinics, January 14th, 2021. And as of today, we have 810 clinics that we have hosted and through the health department, as well as a partnership with the Michigan National Guard and Michigan United. We continue to move forward with those. Resources are abundant, so we have everything we need to make sure that we keep allowing these clinics to keep going and people to get the vaccinations that they need, whatever stage in vaccination that they're in, first, second, third dose, booster, second booster, you name it. So we are ready and willing to be out there. As we move forward, we do our vaccination clinics. We've moved on to every other week for all of our church site clinics. Okay, well, we'll start with our pop-up clinics for the First Trinity Missionary Baptist Church. That is a National Guard hosted event. It is 12 and up, and that's on Saturday, the 28th. And then our continuous clinics with our faith-based partners, Our Lady of Guadalupe, as well as Shiloh Missionary Baptist Church. Again, we have rotated to every other week for those clinics. We did have a week 1, week 3, week 2, week 4 rotation, but in order to make it a little more easier to follow up on with individuals who are participating in these clinics, we've gone to an every other week rotation for them. So those are, again, hosted at our faith-based organizations. This does also include Central Church of the Nazarene that is on the alternating week, apart from Shiloh and Our Lady of Guadalupe. Next slide. Maybe. So we do have testing and vaccination sites still active. They are 3 MDHHS sites that are in partnership with HANU. They do offer testing and vaccination. They recommend appointments at these locations, but walk-ins are welcome as well. It is important to keep in mind that these are Moderna and Pfizer clinics. Johnson & Johnson is not available at those. We are primarily promoting the fact that they only offer Moderna and Pfizer to make sure everyone is aware of what they're walking into. And then other testing and vaccination sites. We do have our Walgreens, Hamilton, and Rite Aid sites still going, dependent on time and day, which is specific to location at this time. Testing is available. Testing is widely available at this time, as Dr. Hackert said, or as you had mentioned, that you can order home tests. You can, we do recommend you report those to the Genesee County Health Department through the website, but I did want to throw out there that if you do have an individual who has a positive test, who does not have access to the internet or has any kind of barriers that would prevent them from using our website, we do have our COVID hotline available. The number for that is 810-344-4800. We ask that you please leave that number open for those that do not have online resources so that they can get the assistance they need immediately. If you do have access to the website, we do recommend you to do that. It is going to be much easier for you, but making sure that we do have that resource available for those that are presented with barriers. Next.
Thank you, Ashley. I want to ask our team to put up one other slide that we found that was on your health department website that shows a calendar of the different events that are going on that's sponsored by Michigan United. They're in partnership with Michigan United. But while they're pulling that up, you mentioned 499 days. Is that what you said?
Yes, we started vaccination on mass vaccination on January 14th, 2021. That was our first public mass vaccination clinic. It was a lot of planning that went into that clinic. So that was kind of our maiden voyage. And since then, we've had 499 days, including today, to perfect our methods and our order of operations. And so far, we are 810 clinics in.
810 clinics. So we want to show this. This is another way if individuals want to go on, and we put up weekly activities. But if you want to go on, particularly to our community health workers and social workers, and print this off so you have it at your disposal, it's on the health department's website. It shows those clinics. Some of the specialty ones, though, with the Michigan National Guard are not showing up in here. So we want to make sure that you know about those special ones. But this is another resource, another tool that you can find on the Genesee County Health Department website. Did you want to add anything else to that, Ashley?
No, you said it all. The flyer is printable. It should print off exactly like you see it. We did create this flyer. This is a brand new flyer to try to make it a little easier for everyone to kind of see what the plan is moving forward by the week. And we should have this available for every month as we move forward.
Yeah.
This is Dr. Hackert. I just wanted to mention that we are losing the National Guard help beginning in June.
Would you say that again, Doctor?
We are losing the National Guard help all through Michigan. It's not just Genesee County, but all through Michigan. They actually started pulling back a couple weeks ago, so we were lucky we were able to continue through the end of the month.
Thank you. Thank you for sharing that. So we'll be able to see that. But the goal here is, when we started this out, we talked about health equity, reducing the disparities. There were people who said they did not have access to testing, did not have access to vaccines. And so we've worked hard. Thank you to our partners, the health department and our federally qualified health centers, and even the hospitals who have provided these extra opportunities. And certainly kudos, great appreciation to all of our churches that have been consistent beyond, even through the water crisis, through this situation we're in right now, to make sure that our community has access to these resources and services. So thank you again. Thanks, Ashley. Kiana Towns is here with us. Kiana Towns Williams is with the City of Flint, and she's as a communications director, she's got some City of Flint news. But also you were wearing another little hat with respect to public health as well. So Kiana, you're juggling this now, public health and communications. So give us a little bit of understanding on how you're wearing both of those, and tell us what's going on with the city for the updates today.
Absolutely. Good afternoon, everybody. As some of you might know, the City of Flint has had an Office of Public Health for about 3 years, maybe a little longer than that. I came on board about a year ago, and that office is charged with being the outreach team for the city of Flint. So they go out into the community and attend events and represent the administration and also City Hall. They are a true resource to the city of Flint. I've said possibly to Yvonne, but certainly to a lot of other people in our community that we are very fortunate to have that office here at the city of Flint and have the opportunity for residents to walk in from the street and be supported. We've had residents come in and ask for everything. I mean, the requests really run the gamut, and our public health navigators have been able to jump in and support residents in finding the resources that they need. So I look forward to that office being around a very long time here at City Hall so that we can continue to help the people of Flint.
So when we come in that front door and we see that office on the side, are we still getting water filters from there as well?
Absolutely. There are still water filtration systems and cartridge replacements available there at the desk. Usually Connie is there. If you tap her and let her know what you need, she will help you out. If you come in and say you need to speak with a public health navigator, she'll tap one of the navigators, bring the resident in and figure out how we might be able to help.
Thank you, Kiana. So what else is going on? Cleaning up our city?
All right, for starters, absolutely. So we are wrapping up. May is Love Your City Month. The final activities are happening today, but we do look forward to having further engagement because we want to love on our city and we want you to love on the city as well. So we want you to look forward to June 11th is the tire buyback day, and it's listed here on the flyer. That information, again, is always available on the city's social pages. On June 11th, residents will be able to drop off tires from 9 a.m. to 1 p.m. at Environmental Rubber Recycling on Dorr Highway. And it sounds like the payments are going to be made there in cash for all drop-offs. So if you see tires laying around the community, even if you've got kids you want to put to work, you might be able to get them to load those tires up and take them over on June 11 and make themselves a little bit of money. So please check out any of the future notifications on the city's social media pages of efforts to make sure that we are continuing to beautify our city. Next slide. Just so you know, we won't be here on Monday. We'll get to stay home and City Hall offices will be closed in observance of Memorial Day. And we do want to acknowledge the sacrifices that have been made by individuals throughout our community on behalf of our country and say thank you. And just remind community that that means that your trash is going to be delayed one day. So you'll put it out one day later. So if they generally pick it up on Tuesday, they'll be by your house on Wednesday. And we will be back here at City Hall on Tuesday and offices open at 9 a.m. Next slide. Oh, so while we're working on that, I did receive notification from, let me make sure I have the name of the organization correct. It is the Institute for Healthcare Improvement and several other entities. They are looking to conduct an older adult older adult interviews to get a sense of what the needs are for seniors across Michigan. So there is a flyer and I'm happy to drop that in the chat in just a moment and it'll also be up on the city's social pages. There is information here where our senior individuals may be able to register for interviews and have the opportunity to talk about what their needs are as these entities are looking to expand their work and make sure that they are addressing the needs of community. They need to hear from the public. And so one way to contact them is to reach out to Janice Jones. Her contact number is area code 517-886-8433. And she's from the Michigan Health and Hospital Association. So we'd ask that our senior members reach out, give their feedback, and we look forward to getting that information collected and those organizations really building to help our elder citizens.
Thank you, Kiana. So this is another opportunity where our community voices count.
Absolutely.
And so your voice counts. If we can say anything today as you've listened to the presentations for today, how important your voice is. There are a number of opportunities that will be coming forward for you to stand up, speak out, and let your voice be heard, because that's what's going to make the difference positively for our community. Programs and services that we are saying as a community are important, and helping to make sure those programs are delivered in a way that'll make a difference for our community. Today, we want to remind our social workers to please be sure that at the end of this session today, you stay on a little bit longer so you can get your continuing education units as community health workers, and then the social work contact hours. You must be registered in the webinar to be sure that you get your information in so that you receive those contact hours. We want to ask you to continue to like us on Facebook. We appreciate those of you that go back and share this, but like us on Facebook, subscribe to our YouTube channel, Healthy Flint. And of course, please feel free to email us at info@hfrcc.org to get more information, or you can call us at 810-835-2130. We want you to stay connected. Please come and visit with us again. Invite someone else to join us next week as we look forward to session 116 of the Healthy Flint Research Coordinating Center's community webinar on coronavirus. Thank you and have a safe, wonderful holiday weekend.
Thank you.
All right.